Hello there, and welcome to Let's Make a Health Connection, your local Health Connect podcast series in Vancouver, Washington. In this series, we interview and showcase the many healthcare providers and resources that are featured on our website, localhealthconnect.com. For those of you who don't know us yet, Local Health Connect is a hub where our community can easily search local resources and connect with providers for mind, body, and spirit health. Thanks for listening today. I'm Jennifer Barber, licensed clinical social worker in Washington and Oregon, and I'm happy to be part of our community of providers. Hi, everybody. Today we're talking to Karen Kennedy. She is a certified nutritionist practicing integrative and functional nutrition. Hi, Karen.
Hi, Jennifer.
Thank you so much for joining us today. I have to say, I am not real familiar with integrative and functional nutrition. And so I'm wondering, there might be other people out there who don't really know what that is. And that might be a really good place for us to start. Can you tell us a little bit about what that is?
Yeah, I've heard that before. So I am a certified nutritionist, which isn't a lot different from being a dietitian. But I guess how integrative and functional nutrition is distinctive is, we think of it as kind of more of an advanced practice of applying a more personalized nutrition care process with the goal of promoting health and preventing the diet and lifestyle-related diseases. So what that looks like is rather than assigning a protocol that goes with a diagnosis, say you have obesity, so here's our weight loss protocol, or, you have diabetes, so here's our diabetes protocol. We take a much wider and deeper look at the individual, their history, their personal history, their medical history, their diet history. We look at underlying causes because, there are underlying causes to, even weight gain and obesity. We think of that as like the root cause of so many things, but there are root causes to that. So we really personalize those things and look at those underlying issues like digestive, the microbiome, hormone imbalances. We can use some more advanced labs, and I guess we have a broader toolbox that we can offer.
Okay, that makes sense. Thank you. I'm wondering, I've been following your videos. You make excellent videos that I see on Facebook with you in your kitchen, being all relaxed, cooking meals and talking to us. And sometimes you say you focus on your gains, not your losses. And I'm wondering what you mean by that.
So, first of all, I'm so glad you're enjoying those videos. Thank you for telling me that. I'm glad. I enjoy making them. That's something I enjoy sharing with people. Focus on your gains, not your losses, really comes from, my experience as being a woman in the world, in my generation, because I feel like I was always given that message, and my peers were given the message to lose, to deprive, to take away, to be less. And those messages do something to you. And I don't always think they're motivating in a sustainable way. So those are two things. I don't like what the message does to a person. And I don't see it having a long-term benefit in terms of people achieving their goals and being healthy. So, like I was saying about, weight gain and obesity, maybe not being the root cause. Maybe there's another root cause to that. I'd rather focus on the gains. For example, weight gain and obesity often comes with hormone imbalances, digestive issues, and frankly, malnutrition. Most people come in with that. So I'd rather focus on, and I find it more helpful to say, let's do maybe some labs and see what you're missing in your body. See where your hormones are at so we can help regulate them and get you feeling good and get you some energy. So rather than sticking your tired self on a treadmill for 45 minutes a day, further depleting you, why don't we see how we can get your energy up, your iron levels up, get your hormones balanced, and get you the right nutrition so maybe you actually have some energy and then all those other things like exercising and cooking will be easier.
Do you tend to have quite a few people coming your way who are their main goal might be weight loss?
I do have that, although because I don't generally advertise myself as the weight loss nutritionist, most people come with weight loss as a secondary thing. I think people that I get are kind of sick and tired of being sick and tired, and in addition, the spare tire could go. But I think most people are at the point where they're like, I just like my heartburn to go away, and I'm bloated all the time, or I'm exhausted. So they start taking a higher priority. But weight loss is on, I'd say, 75% of the minds of the people I'm working with.
Absolutely. So if we just focus on that for just a bit, and then we'll move on to other reasons people come to see you. But if we can just focus on that weight loss, I'm wondering, with your perspective, what do you think are the biggest things people miss when they are trying to lose weight?
Yeah. The experience that I've had with people, there's a couple of things, but overall, the biggest one is that it has to do with the language, is we're trying to lose weight. What we really mean is we're really trying to lose fat. That's what we're trying to lose. But when we go through the conventional methods of weight loss, like caloric restriction and hours on a treadmill, there's other ways too, but that's just a quick way of saying it. It's very easy to also lose lean body mass, particularly muscle. And you actually have to work kind of hard to keep the muscle on, and especially to build it while you're losing fat. Because what happens is when people lose weight, they lose both fat and muscle. And I think most of us are knowledgeable enough to know that, the muscle is metabolically active and help increasing muscle and building it. That helps us to have a healthier metabolism and lose weight. So if we lose both fat and muscle, then it's harder to keep that weight off because our metabolism has taken a hit. And then when we regain that, we rarely regain back all that muscle. We regain more fat. So that cycle of yo-yo dieting puts us in maybe the same weight, but a different body composition with higher fat and lower muscle. And every time we go through that process, we further impair our metabolism because we reduce our lean body mass. And that affects our metabolism, that affects our hormones, that affects our, just our strength and ability to be functional, strong people. So that's what people miss out on, is really focusing on maintaining and building muscle mass.
As I'm listening to you talk, Karen, I'm reminded once again, and this happens over and over again, just a reminder that we all need, that everything we do, everything that's happening in our body is connected to everything else that's happening in our body, and that's connected to everything else. And so it makes so much sense to have somebody like you in our corner, to help remind us, if we make this change, then this is also going to change. And is this positive change or is this a negative change? And to have a conversation about that, I think, is so important.
I agree. I think a lot of us get very fearful of not being able to lose weight, and a lot of us get really desperate, and we want it to happen quickly. So it's nice to have that reassurance that you're doing it right. It's going to happen slowly, but you're going about it the right way.
Absolutely. Okay. So other than weight loss, why else might someone search you out?
Digestive disorders, chronic bloating, and also people who have hormone imbalances like low thyroid, or their sex hormones like their estrogen imbalance. But what I see the most often with people who come to me is they have, and they might not be able to put a name to it, is they have prediabetes. Yeah. And I call prediabetes something different. I call prediabetes metabolic syndrome because prediabetes isn't really pre-anything. it's its own problem, but it's a bit of a silent. I don't want to call it a silent killer because that's a bit much. But it's a silent metabolic disorder that gradually erodes your health, but it doesn't raise the red flags that frank diabetes does.
Mm-hmm.
In the way we approach it and the way we test for it.
Interesting. So somebody may come to you with what their doctor has said, pre-diabetes, and you're going to refer to it as a metabolic disorder?
Yeah.
Okay.
I'll usually call it metabolic syndrome.
Metabolic syndrome. Okay. So how would they know if they had a metabolic syndrome?
Yeah. There's a few things. First of all, I wrote down a few stats because these always surprise me.
Great.
So the Cleveland Clinic reports that about 88 million American adults have prediabetes. They report that prediabetes affects more than 1 in 3 adults under the age of 65 and about half of people over 65.
Wow.
They report that more than 84% of those with prediabetes don't even know they have it. So how would they even know that they have it?
Yeah.
Doctors will diagnose you with prediabetes if you have a fasting glucose that is 100 to 125, because obviously over 125 would be frank diabetes,
Mm-hmm.
type 2 diabetes. Or if your hemoglobin A1C is in a range of 5.7 to 6.4.
Mm-hmm.
And what that hemoglobin A1C measures is that kind of gives you a 3-month average of what your glucose levels have been in your blood. So that's sort of how you get a diagnosis. And what I'll talk to people sometimes and they'll say, "Oh, but my doctor says I don't have diabetes yet."
Mm-hmm.
And that kind of it lets them off the hook. They don't have to do anything about it. And that's the problem because most of us who are in this profession, we can look at people and say prediabetes,
Mm-hmm.
because the symptoms are pretty obvious to us. And that's because the other signs that it doesn't get you diagnosed by your doctor, but we know goes with this diagnosis is an increase in abdominal body fat.
Mm-hmm.
And that by that I mean, that apple shape as opposed to pear shape.
Right.
So one of the best predictors of that is actually the circumference of your waist. And so I often will measure that in my clients and monitor that in my clients. So going back to weight loss, when my clients want to lose weight and I know that they have prediabetes, I will often get them off of their scale because if I want them to put the muscle on, and we know muscle weighs quite a bit. If they're building their muscle and losing fat, their scale's not going to budge.
Right.
So I'll have them measure their waist and monitor that because that will be reflective of healing their metabolism. But the other thing, so prediabetes can take the shape of increased abdominal fat, that apple shape, but also your triglycerides will go up, and you get your triglycerides checked with your lipid labs, your cholesterol labs.
Mm-hmm.
We'll also see high blood pressure. So, increased belly fat, triglycerides, blood pressure, those are all the things we think of with heart disease, right?
Right.
And what's the traditional approach of, wow, you have high cholesterol and high blood pressure. What are we supposed to do when we have that?
Medications, exercise.
Medication, exercise, yeah. But also we've traditionally been told reduce your salt and reduce your fat intake. But right here we're talking about blood sugar, not salt and fat.
Right.
So we've and historically, and when I say historically, I'm reaching back to the 80s here.
Okay.
Some of us remember that all the advice was fat-free, cholesterol-free, and we weren't paying attention to blood sugar as much back then.
That's right.
So we were eating a really heavy carbohydrate rich diet, a lot of those snack wells, those fat-free, cholesterol-free snacks that were really high in sugar. We eat the Yoplait, the fat-free yogurts that are really high in sugar. And so this is all contributing more and more to this metabolic syndrome, this prediabetes, and continuing to allow progression of that disease towards diabetes and an increase in that progression towards heart disease.
Wow, I'm loving all this education, Karen.
Yeah, and so that's a bit tough. So that's how we know when people have prediabetes.
So what would be the first step that people listening today could take if they suspect that they or someone they love might have prediabetes? Right.
So I would say that the first step is to go into your doctor and tell them, I'm worried about this. I know I listened to this podcast and, I felt seen. I was ticking the boxes and I need to know if I'm at risk for this. And so that's really the first step. And I actually have on my website, I have a free little booklet on there that has the checklist of symptoms and the checklist of good labs to request.
Great.
So these are of course you're going to ask for your blood glucose and your A1C. You'll get a cholesterol panel and the usual things. But those you'll want to know what to look for. And the booklet I've got on there it's designed to educate you, to make you a better advocate for yourself, to make you a better partner in your own healthcare. So yeah, go to the doctor. I would get this thing or look it up on Dr. Google. Dr. Google has lots of information on this one. And so that's a great first step to take. Get your baseline labs, get your doctor on board. You might find that your doctor doesn't know as much about this as you do. So this is your opportunity to help them level up and be a better member of your team.
That's always so hard to do. So for some people, it's so hard to go into your doctor and advocate and even to realize, wow, I think I might know a little bit more about this than my doctor does. That's tough. That's a tough position to be in.
It is tough. But, for a lot of, I'm a provider and I get smart clients who come to me with a lot of information. And I'm still a pretty general practitioner and I get, just the other day I was working with somebody I have a few patients who have kidney stones and issues with kidney stones. That's not something I specialize in. And I often will get someone who knows far more than I do about their specific condition. And those are the best people to work with because they're great partners. They've done a lot of groundwork. They bring me all this research. And I know that they're really invested, and they've done the legwork for me, and all I need to do is read what they brought me. And I know there are other doctors like that who appreciate that because a doctor knows a lot of things, but they don't necessarily know everything about your specific thing, and that's your job as an individual to be the expert in you.
Right. Great. So I'm curious. You might not have been prepared to talk about this today, but as I'm listening to you with all of the information that you're giving, I can't help but wonder what brought you into this field.
That's a good question. I think originally I was interested in medicine and biochemistry, and I worked in the healthcare field. I worked in cancer research for about 10 years before I switched over to this. But I always was interested in nutrition, and I took some classes during my undergrad. I think, because like anyone, a young woman raised in the 80s being very body conscious, I was interested in my own health, but also maintaining my weight. Because I've really struggled with my weight as a young person and I had some eating disorders that don't always get recognized as eating disorders. And a lot of these, now I look back at the yo-yo dieting and the struggle to try to restrict my food intake and fighting those hunger, the cravings, and being constantly at battle with myself. I felt like all I did was think about how much I ate and how much I had to exercise the next day to get rid of it.
Mm-hmm.
And as a young person, it was pathological. As a young person, it kind of took over my life, and it was hard. And it was hard just being a little overweight all the time as a young woman. So I was interested in that, and as I started learning more and more about nutrition and metabolism, and then eventually was in a graduate program, I realized I learned more about how my blood sugar works and how my metabolism works, and I was just struck by how counterproductive everything was that I was doing. That everything I was taught about how to maintain a healthy weight, about my hunger, about my body's needs, it was totally counterproductive and was working against my biology instead of working with my biology.
Mm-hmm. Wow.
And what I mean by that is I was depriving myself of the very foods that would control my hunger, that would actually satisfy me and stop me eating. And instead of, I was avoiding fat, of course, like everyone was back then. And as a result, most of our good protein sources, our high quality protein sources, also have fat in them, like meat and nuts and seeds,
mm-hmm.
and some dairy products. And so when you eliminate a lot of the fat in your diet, you also tend to eliminate a lot of the good quality protein sources. And eating fat and protein really help satisfy your hunger. And if you don't eat enough of them at a meal, you're still hungry. And there are lots of triggers for compulsive overeating and binge eating, for sure.
Mm-hmm.
But one of the easy, low-hanging fruit triggers is just eat food that satisfies your appetite, and that means fat, protein, and fiber, mostly fat. And if you don't eat fat, you're going to binge eat.
Mm-hmm. So you are talking about an eating disorder history.
Mm-hmm.
Are you also talking about education, you having education in this field? And the reason I ask is, as a mental health therapist, I work with a lot of people. There are a lot of people in our community, in our world, who are living with eating disorders. And they're wondering, oh, I feel like I need to get help, but sometimes they're not knowing where to reach out. Would you be one of those people that could support someone with an eating disorder?
Yes, but the yes but is important because there's such a range of eating disorders and body image disorders.
Mm-hmm.
And like so many things in my life, personally and professionally, it works best when there's a team.
Absolutely.
So when there's an eating disorder, you always need to be addressing all the things and ideally have all of your team members communicating with each other.
Mm-hmm. Yep.
So for me to say, yes, I understand a lot of the emotional triggers and stress triggers and things like that, but for me to be most effective support for someone with eating disorders, I like to stay in my wheelhouse of why don't we talk about the physiological triggers for binge eating or for whatever it is. And so I can talk to them about meal planning and stacking the early part of their day with protein and nutritious foods, and talk about those physiological triggers and address them. And so often when we have issues like this, people have anxiety. There's anxiety issues, or they have a history of trauma.
Yeah.
And if they're not getting support for those things, then I can help with the physiological triggers, but those other things need to be addressed.
Mm-hmm.
So some kind of really appropriate support for those other issues has to be happening. And I'll give you an example.
Sure.
I had a client, I think last year, and I think she was about 60 years old, and she told me, because in my intake form, I always ask people about eating disorders and trauma. Are they receiving therapy for this? And I asked for a release form to communicate with providers.
Mm-hmm.
And she was getting some therapy and addressing some of her eating disorders at the time. And her therapist actually reached out to me when she knew that I was on this person's team and said, I want to talk to you about this, and was very clear with me about the work that they'd done and the things that she thought I needed to know about our shared client's history and what her triggers were, so I could avoid diet language and restriction language.
Perfect.
And it was wonderful.
Mm-hmm.
It was the best example of good team client care. And as a result, this person got much better care, much better coordinated care than they would have if we weren't communicating or if she didn't have us all on her team.
Oh, that's a beautiful, beautiful example. And I know that there are people who are working in teams out there and so many other people who wish they were, and it just isn't happening. So I'm so happy to hear that you are a provider here in our community that is willing to do it, and you are currently doing it. That is fabulous. So go ahead.
The other thing that I find really exciting about working with mental health practitioners is, and this is also close to my heart, is actual physical support for mental health issues. Because I think all providers know that there's trauma history and there's emotional triggers that they need to work through. But there's also a physiological component of mental health, whether it's nutritional adequacy or neurotransmitter regulation that can be addressed through diet and lifestyle.
Mm-hmm.
And I find that really interesting, and it's an exciting growing field where we're now able to test levels of neurotransmitters. We're able to test genetics for enzyme pathways that help produce and clear neurotransmitters, so we know where things are getting caught up. And so we don't have to, and also testing the genetics of someone to be able to narrow down which medications would be the most effective and least harmful, have the lowest amount of side effects. So being on that end of the team to try to support that kind of healing in a person is really exciting to me, and I'm excited for those kinds of collaborations to start happening in our field.
Awesome. So Karen, as we begin to wind down our interview today, I'm wondering if you might be able to just let us know what new things you have coming your way. I'm hearing that you've got a new site coming up. I'm beginning to see more marketing happening. And then also tell us a little bit about how people can find you. Where exactly do you practice?
Yeah. I'll start with that one. That's the easiest one.
Mm-hmm.
I am located in Clark County. I have a home office in La Center, Washington, or outside of La Center, Washington.
Mm-hmm.
I mostly do telehealth with people, but now and then especially during the summertime, I meet people on my back deck, and I can meet them that way. But mostly I find it's really convenient with telehealth, so that's where I practice.
Mm-hmm.
I have been doing more marketing. I've decided to, shift gears and really focus on a little bit more marketing, and I have a new website coming up mid-August, so that should, by the time this comes out, that should be live.
Great.
Prior to this, I was just focusing on, supporting people and doing that work, but I shifted gears and got a little bit more professional with my marketing.
Mm-hmm.
But what I have coming up is one of my programs called Nourish Your Roots, and that's an 8-week group program that combines nutrition education, it combines really practical stress reduction strategies, and circadian rhythm and sleep support,
mm-hmm.
all together in an 8-week program. And it's a group, so it provides a really supportive community with weekly coaching calls, educational videos and support, and even a couple of one-on-one consultations with me. So it's a program where you get some one-on-one and community support and education for 2 whole months. And I run this a couple of times a year. And I like it because, like I said, the things that people miss out on, it is great to focus on the nutrition aspect, but, if people aren't sleeping, like sleep apnea is one of the biggest causes
mm-hmm.
of pre-diabetes.
It's huge. Wow.
If you sort out your sleep, it can change your life.
Yes.
and I've got a good guest presenter on there who's a sleep expert. So it's a great course for learning how to really self-regulate, kind of advanced self-parenting techniques, but also how to become a really good advocate. There's a lot of material on learning the whys behind all this health advice, so you become your own nutrition expert for your digestion and metabolism. A lot of good stress reduction techniques that don't take all day, little 3-minute and 10-minute things you can stick in your day when it's convenient.
So if people wanted to sign up for your Nourish Your Roots class, how might they go about that?
They can go to my website.
Okay.
It has all the information, and that's realfoodmatters.net. And that gets confusing. It's realfood- or realfood-matters.net.
Great. And I'm going to put that in the show notes when this podcast goes live, where people can find that. We'll have that in the show notes. And then we'll also have your new website there as well. So that'll link directly to you.
And that little booklet on metabolic syndrome.
And the booklet. Yes, absolutely. Yeah. I'll get that information from you too.
Great.
Awesome. Anything else that you want our community to know about you or your business before we sign off?
I just like to have a real human conversation with people sometimes. Working with a new practitioner is a big commitment, both financially and also, you have to meet a whole new person. So I always offer people a free 30-minute phone call to just talk like this. Talk about what you have going. I have deep pockets in terms of referral network.
Great.
So often I find I'm talking to somebody and maybe what I have to offer isn't quite their first, their next step. And it gives us an opportunity to identify what's really going on and what their current needs are and maybe point them in the right direction.
Awesome. Karen, I just want to say thank you so much. And the information that you've given today, hopefully somebody's listening and they've made a connection with you and they'll give you a call. And I just want to say thank you so much for being part of our community and such a needed resource for people out there.
Oh, great. Well, Jennifer, the pleasure's all mine. I really appreciate you asking me to.
Thank you again for listening to Let's Make a Health Connection. Find us on the interwebs at localhealthconnect.com. Also search for us on Facebook, Instagram, and Twitter. Links and show notes for this interview are available on our podcast page. I really enjoy putting these interviews together, and I hope you made a health connection. We'll talk again next time.
Let's Make a Health Connection, copyright 2021, all rights reserved, is the exclusive property of MBS Therapy, LLC, a Washington-based company. Local Health Connect is inclusive and does not endorse any political or religious group. Thank you again for listening, and we'll see you next time on localhealthconnect.com.